I do think that the term secondary progressive MS is probably underutilized by practitioners, and I may be guilty myself to do this, and I can tell you why. Because secondary progressive MS is one of these terms, if you use it, for the patient really despairs, because it's their concept that now their MS has ended at a point where there is far less control of the condition and where there is almost an inevitable outcome of disability. So we need to understand that from a psychological point of view, using the term secondary progressive MS is really something that burdens the patient very significantly and actually can lead the patient to have anxiety and also in a way to despair. It's not unimportant to keep in mind that suicide rates, particularly in patients with more advanced multiple sclerosis, are significantly higher than that in the general population. So that's kind of the psychosocial background. Secondary progressive MS is also a condition or a part of the MS spectrum that develops once the patient has had multiple sclerosis for a period of time. Before the treatment era, we kind of quoted that the patient transitions, or 50% of patients transition into secondary progressive MS somewhere in the middle of the second decade of having multiple sclerosis. So if you assume that a patient with MS, or that a patient is diagnosed with MS in the early 30s, add 15 years, so you are somewhere in the second part of the 40s for this particular patient. Patients with secondary progressive multiple sclerosis very often have disability measures that are higher. In multiple sclerosis, we often for clinical trials use the EDSS. The EDSS is a measure that is used in clinical trials to prove or ascertain effect on disability of a certain agent. EDSS ranges from 0, completely normal, to 10, dead. Normally, patients with secondary progressive MS are with EDSSs of 4 and higher. And the second part of the socioeconomic impact of this is that patients with an EDSS of 5 and more very often are no longer employed. So that's where the disability impact comes for these individuals with respect to socioeconomics. Obviously, as ambulatory function, as other neurological functions are more impacted in the later stages of the disease or in the higher disability stages of the disease, it is also important to note that the patient may start to transition on being dependent on another individual for certain aspects of instrumental or activities of daily living. And it is also important to note, as we perhaps previously discussed, that a patient that is 50 and older, such an individual obviously has higher likelihood of additional comorbid conditions which may impact the overall functioning. Think, for example, somebody that has in the early 50s had diabetes for several years and now may have also some diabetic comorbidities together with secondary progressive multiple sclerosis. So our goal in MS is really to keep patients away from transitioning into secondary progressive MS. And it's very important to note that early effective treatment based on very large registry studies and based on studies from national registries, for example, the Swedish National Registry, that such early effective interventions really benefit the patients by reducing the likelihood of transitioning to secondary progressive MS.